Hi Ajay, it's great to have you here.
Hi, it's great to meet with you today.
Awesome. I had a couple of questions for you. I'd love to understand that you come from an embedded systems and medical devices background, right? You not really come from a nephrology background. So, what was that moment when you guys looked at kidney care and thought that this is a problem that you guys can solve as an engineering problem?
Oh, great question. I think we need to talk about what we were actually before our current form, which is an AI company. So, before we are in our current form in our evolution, we used to be a hardware primary company where we used to make biosensors which are focused on measuring any metrics that sort of improve and affect cardiorenal care. And during this process, or during the process of developing the hardware, right, we had a lot of interactions with several nephrologists and researchers in nephrology, and a common feedback that we received was to include a methodology to measure cardio, thoracic, renal fluid levels. So after a while, we caved and we kind of like started asking them, okay, why do you actually want this metric? Why do you want us to measure this metric? And they told us pretty much what everyone told us was that once a patient gets treated for any renal condition and they're discharged, the doctors have no clue what happens.
Yeah.
Cardio-renal care doesn't really end once a patient is discharged, but also continues at home, right?
Right.
Because whatever happens at home also matters. And the problem with doctors today is that they are not able to track what happens after the discharge.
Yeah.
And basically, what happens is after a patient is discharged, after the first contact and the first diagnosis, they end up getting readmitted almost 30% of the time in the upcoming weeks. And it goes up to 50% in specific conditions where they have some kind of predispositions, or they are of old age and those
Right.
kind of cases. And we realized and we looked into that specific problem where readmissions are a major pain point and a major cost factor in today's world. And after a year of research, we came to the conclusion that okay, it makes sense to work on a solution that will overall improve readmission outcomes, because we are in a day and age where AI and multimodal continuous computing capabilities are there. So yeah, that is very interesting.
That's very interesting. I think what you mentioned really stood out to me that it is not episodal care, but it requires a continuum of care. So
Exactly.
those touch points need to be built out for any chronic condition, but especially for ones that last that long, like
Exactly. Exactly.
nephritis, right? Awesome. I think another question that I keep thinking about a lot whenever I talk to healthcare companies is that typically hospitals do not trust risk scores or any sort of new tools till the time there's a strong proof point that's been built out. But building that proof point in itself requires you to do these pilots, retrain, reiterate, right? So, how did you break that cycle with Mayo Clinics when you guys went live with them?
I think the answer to this question is right in the question. And we started off as a nephrologist first company.
Right.
What I mean by that is we started off with the suggestions of nephrologists, and we are continuously getting feedback and getting suggestions from them with like whatever is going on in the AI world and whatever is going on in the world of medical data.
Yeah.
And in fact, our mentors are two of the world's leading nephrologists, one with almost 5 decades of experience in surgery and improving outcomes. And the second one is arguably the world's leading researcher in AI in nephrology. And we continuously interact with them and improve our product and modify our design so that it is always a combination of their principles and a trade-off between one's aggressive style and one's conservative style.
Right.
And I think for the coming to the question, I think the answer is pretty much that what we do is we make a solution that makes doctors' lives easier and allows them to focus on what actually matters and not the buzzwork and wherever they might not as be efficient. So yeah.
Yes. And has starting the agreement with Mayo Clinic changed the way people perceive you? Is there more trust inbuilt by the fact that you're working with Mayo Clinics now?
100% I would say, because the thing is previously our models were built on openly available data and basically from institutions, open source institutions where the data might not be of the best quality or something. But Mayo Clinic have a history of collecting data and being clear with patient privacy as well, right?
Right.
They are still sticklers over patient privacy, and we cannot even build certain types of model that might risk exposing the patient. So our models are right now privacy first, And due to a diverse and large data set, we are also able to capture patterns that we can probably not capture anywhere else because that data is just not available. So yeah, it has done it 100%.
That's awesome. And would love to understand that there are a bunch of these new age tools that have come up that also provide predictive models, some for other conditions, some specific to nephrology as well. And then some of the more legacy players have also tried entering this space. So when you're pitching a solution to hospitals or clinics, how do they perceive you vis-a-vis your competitors, and how do you make them understand your sort of differentiation or your product?
Oh, okay, great question. So the thing is, the way we primarily differ from any existing solution, be it new age or legacy, is that the legacy solutions and new age solutions tell you a patient is sick, and basically when they are continuously being monitored, when their vitals, everything is within the hospital environment, and whenever they are continuously being monitored under reliable conditions, is what they call them. So in these conditions, the existing solutions are able to tell you whether a patient is sick or not and whether to spend time or them or not. But
Right.
due to being or having access to a wide universe of data, like a diverse type of data, and frankly, a lot of data. So not just reliably, but also be able to predict with a element of confidence that this matters more, or it is better to prioritize on a patient A or a patient B, or when to prioritize and when to intervene and what to intervene with, right? Because the sheer amount of data allows us to give suggestions at every level. So to put it in one sentence, I would say existing solutions tell you a patient is sick, but we tell you who to call today.
Hmm. That's a very, very interesting approach given healthcare, especially in some of the developing countries, is extremely overburdened with patients. Prioritization becomes the difference between hospitalization.
Exactly.
Very interesting. Also, would love to understand that whenever you're having investor conversation, which is your favorite question to get?
I wouldn't say this is a recurring question, but this is a question that was asked once that really struck with me. And a person asked me that, okay, this is a solution, this is AI, this is obviously math, but it is still a predictive model, or it is still, there's still an element of uncertainty. A nephrologist will be confident in using a solution only if they are able to identify when or in what case that particular solution is unreliable. So when a nephrologist knows that, okay, in this kind of condition, I shouldn't trust the outcomes or I shouldn't trust the suggestions, I should be able to intervene myself and manually take over. And the answer I would tell you is, basically, since once again it goes back to the amount of data that we have,
Yeah.
and since we have a large amount of data and multimodal data, we are able to tell you that tell you with an element of confidence that, okay, this suggestion should be done or not. What I mean is, for every suggestion or every prediction, it comes with a confidence score, and we are able to tell you that, okay, in this particular suggestion there's this much confidence. And we have also designed our UI such that any prediction or anything that is suggested to the user comes with a variety of reasons why that particular suggestion is there. And that also aligns with FDA principles and FDA methodologies, that a human always needs to be in the loop and the decision needs to be taken by the human. So that is how we manage that.
Makes a lot of sense. I think that's super interesting. Thank you so much for taking out the time. It was
Thank you
great
so much.
chatting with you.
It was great talking with you.